America is getting fat. Obesity is becoming an epidemic in America, and 2 out of every 3 Americans are either overweight or obese. According to healthyamericans.org, obesity rates among adults have increased by 350% in the last 30 years. It is estimated that more people die each year from obesity-related illnesses than from breast cancer and colon cancer combined. Such illnesses include high blood pressure, heart disease, diabetes, and respiratory problems. There is a financial consequence also associated with these illnesses. We need to put a stop to obesity. It is preventable and can be reversible. What is making America fat? Well, let's take a look at the diet and lifestyle of the typical American. Burgers and fries. They are quick and easy for those of us on the run. We consume more than the standard caloric intake of 2,000 calories. Most of us consume that in just 2 meals alone. The quality of food we consume is also lessened from years past. Before, most of the food that was eaten was from the local farms and markets. Now everything is processed and mass-produced, so it is cheaper. Who doesn't like a bargain? We choose convenience and cost over quality almost every time. It doesn't help that most of us live sedentary lives either. Children spend more time playing video games than they do playing outside. Technology has made it easy for us to become lazy. So how do we combat obesity? We need to get off the couch. That is just stating the obvious, but there are many other ways in which we can do this. One way would be to teach our children to eat right and go outside and play. Others include placing higher taxes on fast food restaurants. Don't forget about the fad diets that promise quick weight loss. The only problem is most people gain back all, if not more, weight. How many of us have been there before? I know I have. The solution? Bariatric surgery. It has become recognized as the most effective solution for long-term weight loss. There are different types of bariatric surgery, including gastric bypass surgery, where the stomach is stapled for a portion of the stomach is completely transected. Vertical sleeve gastrectomy is another option, where 80% of the stomach is removed. These surgeries do have many potential complications, including death. The risks need to be carefully weighed with the benefits before opting for one of these major surgeries. The less invasive option is gastric banding. This involves surgically placing a silicone adjustable band around the upper stomach in order to restrict the amount of food that is consumed. Bariatric surgery is by no means cheap. It can cost anywhere from $20,000 to $50,000. These costs include fees for the anesthesiologist, the hospital fees, the surgeon's fees, lab fees, and device fees, just to name a few. The good news is most insurance companies are starting to recognize obesity as a disease. They do, however, require certain steps to be made. Some include medical history and documentation of your struggles with weight loss. Others include a psychological evaluation, a nutritional evaluation, and even in some cases, a supervised diet program by a physician. Sometimes it's even 6 months. If you don't have insurance, the whole cost is your responsibility, but some clinics can help arrange financing for you. How can bariatric surgeries help? Well, these options have benefited patients by stabilizing blood glucose levels in patients with type 2 diabetes, improving blood pressure in patients with hypertension, help in eliminating obstructive sleep apnea, and decreasing joint pain, basically improving your overall health and quality of life. It benefits the insurance companies too. Those extra pounds rack up billions of dollars in weight-related medical bills. The amount of money they spend on medications for the patients will greatly decrease too. Imagine it. No more insulin, no more high blood pressure medication, and no more BiPAP machines in order to sleep at night. The list goes on. Obesity is an epidemic and can be reversed. As you can easily see, there are many obesity-related illnesses that can be eliminated by opting for bariatric surgery. It's not cheap, but like I stated, most insurance companies are starting to cover these surgeries because they have seen the benefits in the long run. Imagine going from America is getting fat to, wow, America is healthy. I happen to be one of those. that wants America healthy. I hope I have answered any questions you may have had regarding the need to combat obesity and how we can help reverse it. I myself am opting for the surgery. I want to be healthy and want to stop the obesity-related illnesses before they begin.